I've been coming here for a long time. It's something I would love to do. We done been to toy giveaways, food drives, spaghetti dinners, because Miss Tay likes to dip her sauce. Wait, this is the pan right here. Like to dip her sauce for the spaghettis, the organization. And I just enjoy the atmosphere, the laughter. We talk about everything from our personal lives to what goes on in the world, and just being a family, because Black Lives is not just who we are, but it's like we are a family.
I think sometimes people hear harm reduction and they think that it's all needles, all pipes, and nothing else. Like, here's your thing, use your drugs, and that we're like, come on, get high. But what harm reduction actually is, I usually say to folks, it's really neutral. It's morally neutral. We're not telling you to use drugs. We're not telling you not to use drugs. We're dealing with the very real fact that people use drugs and that those drugs come with specific set of risks. A lot of it is connecting people to a system of support who are normally outside of eligibility for the other existing systems of support in New Jersey. Harm reduction services are so vital that you don't even see the things that they prevent in your community, right? We know that communities that have a harm reduction service have a reduction in HIV transmission, like a reduction in new HIV and hepatitis cases. We know that there are better maternal health outcomes for women and pregnant people who use drugs. We know that there are significant reductions when naloxone is accessible as easy as a bottle of water off the shelf.
In the Latino community, HIV, sexual health, when it comes to substance use, is stigmatized. So it's something you don't talk about. Culturally, we don't talk about what happens at home. So when people come into the agency, we try to form a relationship with them so they can feel comfortable, and they start to disclose certain things they wouldn't openly talk about when they first come in for services. So we develop a relationship first, and then we just say, okay, and here are the services that we have. But it's crucial to develop a relationship with the clients that come in.
My dad had substance use issues, and my dad used to frequent this area, and this was when I was a teenager. So I know a lot of this community for years, and I've been doing a lot of my work here for it since I could remember. When I used to come on these same tracks that I provide services, I used to come look for my dad.
When this movement started, it was syringes off the back of ambulances. People who are like, I know that syringes save lives. I need them in my networks of people who are injecting drugs, so I'm gonna make it happen. And it was like doctors and nurses and EMTs who were like, no matter what the law is, I need to do this. And I don't just mean in New Jersey, I mean across the country and across the world. And then these really smart researchers who were like, I'm also gonna study it at the same time and show that it saves lives.
We've dug ourselves in a pretty deep hole in the United States. We have a set of policies and programs and environment in place that's taken us from 3 decades ago, fewer than 10,000 overdoses a year, to, as of like 3 or 4 years ago, more than 100,000 overdoses a year.
It's a big epidemic in our country with drug use and fentanyl in the supply. I've been doing this work for 20 years. Oh, she wants some supplies. Hey, what's up, lady? What's up, T? How you doing? All right, what you need? What you need? You need everything. Make her a bag up. Yeah. So you know these fit packs, right? These the one you put the old syringes in and bring them back here when you want some more. Stay clean and stay safe. These the disposable wipes. And we got plenty of more. If you need some more, come back. Yeah, the Narcan up in the front. It's one in here, but give her another box with 2 more. Yeah.
One night, I was asleep. I got a knock on the door. Said somebody I was using drugs. I grabbed the Narcan. I went out. I went to the person, and I went down. I looked at them, felt their breath, checked to see if they had a pulse. They weren't that far gone into the overdose to where I can talk to them a little bit. So I told them I was going to Narcan them, and I gave them the Narcan. The first one, they didn't come to right away. So I gave them a little sternum rub. Then they came up, they jumped up. And then by then the paramedics was there. I said, my job is done.
What I do, I with the overdose response team. So twice a week, we go out with University Hospital and we respond to all the overdoses in the city. The other 3 days out the week, we doing follow-ups, empowering the community how to use harm reduction tools, how to identify an opioid overdose, and how to call and get help. Jenna and Caitlin is powerhouses in New Jersey harm reduction. They was one of the first ones that I know doing it on the level that they doing it on.
New Jersey Harm Reduction Coalition, it was founded around 2019, and we're about maybe like 8 or 10 of us originally who came together just to talk about like the gaps and what we were seeing and what we could really do about it. And that's how I met Jenna Meller.
I grew up outside of Atlantic City around a lot of visible drug use, a lot of visible sex work, and there was not support for people. You were incarcerated, not treated with care. And so I started working in harm reduction. I was running an outreach program in Washington, D.C. While I was doing that work, my friends here were dying. So I moved back to Jersey. I just talked to literally hundreds of people. Like, what is going on? Where's the harm reduction support? Why aren't we doing the thing that saves lives? And I learned that we have the most restrictive law in the nation.
In New Jersey, municipalities essentially made their own decisions about whether they wanted harm reduction programs to be permitted to operate in those jurisdictions. And that essentially programs operated on a pilot basis.
We, Atlantic City, Camden, Newark, fought for the right to operate a harm reduction center, and they won that right, but it was only allowed in 6 cities. And you had to get your local town council to approve it before you could open.
There were 7 harm reduction centers in a state of 9 million people, and they were really located only in cities that like started them out of like desperation. There was no other option. There were high concentrations of HIV. It was just prohibitive.
We have to change this law. We need to make harm reduction services available in every corner of the Garden State. And we did. Racial justice advocates, civil rights leaders, faith leaders, people who use drugs, people fighting for less incarceration and better support for people coming out, people who are doctors in their communities, nurses, social workers, who say like, enough is enough and we can do something different.
When the opioid settlement came in, we were lucky that I got connected with somebody who knew about funding from Vital Strategies. So that was our stepping stone into getting funding for harm reduction. And then we started getting funding from the state and from the county.
This car is equipped with Wi-Fi, so people that are unhoused, if they need access to the internet, they can come within 30 feet of the car, check their dental records, their medical records, file for applications. These are our bags that we have. They come with a bottle of water. We have the metal caps here. It comes with some chapstick and a flashlight. What we do is we take a box of Narcan, we put them in the box, and then we take some Nutri-Grain bars. We're usually out at night, and when the soup kitchen's closed, sometimes people don't get a chance to get the food, so at least they have something to hold them over until the morning. Our hygiene kits come with toothbrush, mouthwash, combs. We have saline, bandages, and so on and so forth. We put each kit in the kit, we fill it up, and then we go walking around the neighborhoods.
It's about educating our community. It's about giving them the services that they normally didn't have access to.
For Saturdays at the Quaker House, we're there by 8 in the morning, and we're doing 200 spaghetti dinners, and we're there until it closes. Thursday evenings, we do our harm reduction outreach. One of the things we do is called the Twerk and Fold, where we actually rent out a laundromat, we get a DJ, we get snacks, and people come in and wash their clothes for free. We have coats, hats, gloves, mainly new, gently used. We don't call our people clients. We call them fam. With their permission, our elders, we call them auntie, uncles. Our peers, we call them siblings. Our younger generation, we call them niece or nephew, to foster that family and community like so. They're more comfortable and they know they're not gonna be judged. They're gonna be seen as family.
We do community syringe sweeps. We have vending machines in the city of New Brunswick. They're free and they're accessible, and they're not just naloxone. They're Band-Aid kits, wound care kits, fentanyl and xylazine test strips to keep folks safer.
There's so much more to harm reduction than what has been presented. People get to have access to all the services that they need to be able to thrive.
So we're out here, Project Now, nonprofit organization founded by my brother and myself before he passed away. I got clean in 2000, and since then he incorporated me in. We out here every second Sunday. We give out these trays with a collaborated partner.
We give them hot meals on Saturday. We give them bread, bagels, donuts, pastries, you know, whatever we can do for them, we do for the community.
Yeah, that's
you know.
every Saturday.
That's
We're out
every
there
Saturday. Coats, clothes, sneakers. I like doing that. It makes me feel good, you know. So I'm in it for life.
Most of our participants have every reason to not trust the system because they've likely been failed by the system in many ways.
I work with people every day who, on paper, would need emergency care, right? Like ER, like stat. But the experiences they've had at the ER, being treated like subhuman, the medical racism, the being told, well, what you really need is to stop using, that means I'm not going to the ER.
We understand our people are over-policed, stigmatized, criminalized, all the lies. What I would like people to understand about the relationship between race, stigma, and access is that forever we have been criminalized specifically because we're Black and brown. We were seen as addicts, as criminals, as horrible people, but our white counterparts had a sickness. They had mental health issues. They were humanized, and then we were treated like animals.
We just don't give harm reduction to the users. We give harm reductions, it might be unorthodox, but I give it to the dealers too. I give fentanyl testing strips and xylazine testing strips to them. You should hear the stories. Dang, good. I'll use my last bottle of Narcan on this dude in the trap house. I know when our communities didn't have this, and I just know the reason why we got it, because it's a healthcare crisis right now. When I was growing up, it was criminal.
Decriminalization of drugs, it absolutely is necessary if we want to actually help folks heal from the consequences and the harms of the drug war. Addiction or chaotic use, those are things that we actually know how to help folks through them. It's when folks start to go on that process and then an old charge comes up, they get picked up on a warrant, they have a fine, they have a record that doesn't let them get an apartment or a job, things like that come up and they get in the way and it's a setback. And so criminalization of drugs to me is the heart of the harm.
It's been a building situation, gaining more and more of a relationship and trust from the community members. I mean, one of the best moments for me was the fact that when Kwa, who lives here in the neighborhood, was joining the effort, her kids became kids that I know, and her oldest, the one over at the piano. So, as I say, building the relationships within the community has been strong.
Harm reduction is about all of that. It's about the impacts of drug policy, of stigma, of racialized policies that our country was founded on.
As a village, they have helped me to want to better myself. It's not just about them giving, it's more or less it's their heart and compassion about it. And I don't see them talking about, no, you can't get this, and it might be the last meal. No, you want that, hold on, let me go to my car. I've seen them do that, we've done that. So from what I've seen and what I've got out of Imperfect Village, is the imperfect love that they give to not just me, but to the village out here in the community.
It's really emotional to hear the impact that we're doing and to see it, and then to know that those people also are coming back into the family. Like you said, we are a family. And they are, continuing it. It's like just something that's just gonna live on. And I think you said it perfect, and I think Siobhan named it perfect. We are in Imperfect Village.
Right. During the summer, we have a community block party with a book bag drive, and we noticed a gentleman sitting in the corner by themselves, and we just had a conversation, and he was embarrassed because he soiled himself, so we was able to get him clothes, get him freshened up, and we just sat there and talked to him for maybe about an hour, and then he came back the following Saturday when we had our outreach, and he told us that day he planned on transitioning to become an ancestor, and he didn't because we took the time to acknowledge him and see him. And just from that, he felt the love, and he felt people generally care for him, so that kept him here. So I'm just getting upset. But just to see that and know that we potentially was able to keep somebody here, now they know that somebody does love them, somebody does care for them genuinely and unconditionally.
I have seen people's lives change They are alive because of harm reduction services. Specifically, where I worked with BLM Patterson, I have 2 people that are proud to say that it was because of the services they received. They are now in recovery, working, having a life that they did not see possible. When you see the light come back into someone's eyes, when you see them getting their life together and just thriving, however they define that, it's amazing.
We need more philanthropic support. We need more funders who understand that harm reduction is healthcare, that harm reduction is community care. We are deeply organizing in our communities. And harm reduction is economic policy. We save tons of money for our local governments. We've done so much work to make harm reduction, to like normalize it, you know? Make it familiar and like a term that people hear and people embrace. And that's hard fought. And the next step is to make sure that these services stay community rooted, that we are not taking money and giving it to big institutions who have a role to play for sure, but the community role in harm reduction, if you take it out, then you won't save lives. Then you won't see the growth that we're seeing in New Jersey. And by growth, I mean less people dying from overdoses, more people connecting to care.
I told you she was gonna give me about that sauce.
Yes, I am.
It's not even the sauce, it's the noodles. Let's get that right, the noodles.
3, 2, 1, action.
Hi, I'm DJ, and this is our program director.
Oh, say her name.
Oh, okay. Let me do another take.
With my girlfriend.